Good morning, everyone. Thank you for joining us this morning on this episode of My Town. Please join me in welcoming Caroline Chinouth, the Director of the Carter County, Johnson County Health Department. Good morning, Caroline.
Good morning, Tammy.
How are you today?
I'm doing fine, and you?
I'm doing well. Thank you so much. Well, I thought the first thing we would just clear right on out of the way.
Yep.
Let's get everybody caught up on what our services of COVID-19 and this new Delta are looking like.
Right. So the health departments are still doing COVID testing and vaccination. We do the testing and vaccination here in Carter and Johnson County Monday through Friday. We do that 8:30 to 4, just any time. You don't have to have an appointment. You can just drive in or call inside when you get to the parking lot, and we'll take care of you. The vaccines that we're using, we are seeing some Delta variants and others in the community. It does look like the vaccines that we're providing and have been providing are very effective.
That's wonderful.
Against those variants as well, so it does provide protection. And that plus mask usage is our best, those are our best tools right now still.
Yes, still the best defense that we have.
Absolutely.
And are we seeing like lessening of cases, or are we seeing a bit of a flux with this new Delta?
Well, as always, these things ebb and flow.
Right.
So that it's not a static trend one way or another.
Okay.
But again, there is still enough of a presence that certainly protecting oneself with vaccines and using those social distancing and mask use measures are very important still.
Yes, and washing those hands.
Yes, absolutely. Absolutely. Always.
Always washing those hands.
Yes.
Well, we got that all out of the way because that's all we've talked about for years with the health department.
Yes.
So now we can move on. Talk to us some about our traditional services that people may not even realize that are being offered now.
Sure. Well, thank you so much for that because truly the health departments are back in business. We are returning to in-person services. We still do a lot of curbside work. You pull up and we do some of the portions of your visit outside. And certainly if you wish to remain outside, we can take care of you that way. But we do have folks coming back in.
That's great.
The health departments are just the one-stop shop in your neighborhood for getting all of our preventive services for children. We ensure that they are having regular checkups from the time they're babies until they turn 21.
Oh, wow.
So, and those services include those checkups, those periodic checkups. They do include vision screenings, dental screenings, and that sort of thing.
Everything.
So, yeah, and that's a really great way to have, for us to ensure that we have our eyes on your child.
Yes.
Throughout that child's growing up years, and we can detect things along the way and ensure that they're getting those regular screenings if we're not the ones doing them, to ensure that, along the way, if anything comes up, we can work with parent and mom and dad together on, what to do.
Yes.
So that's a really big part of what we're here, in the community for. Of course, we provide men's and women's health. We provide, here in Carter County, we do have a primary care clinic for uninsured, so that we can take care of some acute things that come up. We've got limited providers doing that, so it's sometimes hard to get an appointment because we're, seeing as many people as we can with the hands that we have available. But that's a really important service. We do have dental services here.
That's amazing. I never knew that.
Yeah.
I never knew you could provide dental services. That's wonderful.
Sure. And we provide that here and in Johnson County both. We see children for all kinds of preventive dental care.
Yes.
And we do see adults with emergency need of relief of pain, and it's going to be an assessment to make sure that, first of all, we've got anything stopped that may be infected,
Oh, of course.
and then follow up as needed with whatever is going on. And that's for folks, who don't have dental insurance. So that's a little bit more limited than the child, than the child preventive services, which are a little more comprehensive. Now, we don't do crowns and things of that nature, the cosmetic care.
Right.
But we can help provide referral. In fact, that's a lot of what your local health department is for. If we don't provide the service, we're going to ensure that good, warm handoff
That's wonderful.
to the next provider who then we can ensure you're getting what you need.
That's amazing.
So-
So you all do a lot of that.
Yeah.
And you help people find what they need, where they need
Exactly,
for their
exactly.
health. And just preventative
Exactly.
measures, which, what is that? An ounce of prevention is worth a pound of cure.
It always has been, and it always will continue to be.
Yes,
You know,
definitely.
your grandparents weren't wrong when they gave you that
Yes.
when they gave all of us that saying.
Yes.
They were absolutely right about that. And we also have an arm of the health departments that do case management for families that are in need. We also do home visits. We're beginning to get back
great.
into those again. So we do not only some education with families that may help them in raising healthy, strong, kids that are doing well.
Yes.
But we also, excuse me, very much like the referral that I was talking about,
Yeah.
that is our arm of connecting families with the resources they need.
That's incredible.
And our-
sometimes you just don't know where to turn.
Yes.
Yeah.
And our team of Chant home visitors and case managers, Chant is the acronym for the program, they are so knowledgeable in each county about the community resources that are available. These folks, this is such a great team of just a wealth of knowledge
That's
about where families can go to get the things that they need. And they establish those relationships. In fact, your local health department is all about establishing that relationship with the family.
Yes.
To make sure that we're following you through your family's growing up and doing well. And again, the only thing that sort of hampers us, or the only thing that would serve as a limiter for us, is just how many provider hands we have available at
Yes.
any one time. So
Exactly.
yeah. So yeah, the health departments are open for business, and we hope to take care of everyone in Carter County. Of course, we also do in Johnson County, and we also do all of the birth and death certificates.
Yes.
So we do those vital record requests and that. So
And the shot records.
Absolutely.
And getting ready for your
Going back-
passport.
Yeah.
Coming in and getting your birth certificate.
yes, yeah, and we actually can refer you. If you're going to overseas travel, we can refer you what you need and where you need to go to get those immunizations for travel.
Yes.
And also right now, what time is it right now is back to school.
Yes.
And
Oh, my goodness,
parents really, I would advise you to bring your kids on in to get those back to school immunizations and get those back to school things that you need to have to get them ready to go. Don't wait till the last minute, because it gets really crowded.
I bet it really
Yeah.
does, because they'll send out those letters. But
Yeah.
if they just do a little preemptive care here, they can
Yes.
come on down and you all could provide what they're going to need for what grade,
Much
what
shorter
age.
wait.
Yes.
Much
Knock it out.
easier visit. Yes, yes.
No
much easier
doubt.
visit.
Well, let me ask you, I remember we were visiting once before. Is there like nutritional programs that you provide?
Oh, absolutely. Thank you so much, because part of that child health services
Yes.
and the preventive care for children has a lot to do with our WIC program and our nutrition
yes.
program. And we've got some great nutritionists on staff who work with families on how to eat well on a budget, how
Yes.
to eat well, to use food as a way to stay healthy and to stay out of the doctor's offices.
Yes.
And then, of course, we provide those WIC benefits. And again, with all of our services, we are beginning to see people back in the health departments. We like to have our eyes on parent and kid. But we also do still provide those services curbside. So we take lots of safety precautions inside.
That's wonderful.
Whole lot of safety precautions inside, so you can feel comfortable. You can feel good about coming inside your health
You
department.
know you're safe.
Yes. And but we do provide the WIC program and all of the associated education with it.
I thought that was so interesting, because she was talking about how to make cookies out of beans or something.
Yeah.
And I thought, oh, I want to know this. How do you
Yes.
make cookies out of beans?
Yes, we do provide some demonstrations on occasion. I don't know that we're back to doing that part yet, but we certainly are wanting to get back to that part.
Yes, how exciting. That's funny and that's fun.
And it's great for kids to be there with their parents and trying things that were prepared in a healthy way out of
Yes.
healthy ingredients that mom and dad can get with their WIC benefits. And the kids are totally stumped.
Oh yeah, they're excited.
And
They're like,
they
"Please
love it.
Tell me more."
Yes, and they love it, and we can slip that good nutrition in without them even knowing.
Oh, they don't even know.
Yeah, yeah.
That's
Yep.
always the best way.
Yep. And then send parent home with the with the guidance on how to fix those
the
things, how to
knowledge.
recreate those
Yes,
meals.
and
So
use that WIC to really increase what they already buy.
yes.
To really stretch it.
Yes,
Yeah.
absolutely. And shopping, working with mom and dad on shopping
Yeah,
techniques
budgeting.
is a
Wonderful.
lot of what we work with. So
awesome.
the health department is really a great one-stop shop for your family.
Yes, it's our
And
cornerstone.
absolutely,
Really. It really is.
Yes, it really, really is. And again, a lot of our work is just making sure that we do those warm handoffs when we have services that we don't necessarily provide here, but we're going to make sure that families are connected with where they need to be.
That's amazing. Well,
Yeah.
thank you so much,
Thank
Caroline.
you.
If you will, just let them know when and where and everything that's to come in and see you.
Sure. Well, in Carter County, we are on 403 East G Street. We are open Monday through Friday, 8 o'clock to 4:30 in the afternoon. We are available here through curbside services or walk-in, just walk right in. In Johnson County, we're located at 715 West Main Street in Mountain City. And again, we're open Monday through Friday, 8 to 4:30.
Thank you so much, Caroline. I hope you have a wonderful day.
I hope you have a great day too, Tammy. Thank you for taking your time with us. And I hope to take care of everybody soon.
Yes, let's get everybody healthy.
Yeah,
Thank you. Bye-bye.
thanks.